Hi class, this is going to be hopefully a little overview on the heart. We've already done the blood. God, I've got a tickle in my throat. We've already done the blood, so now we're going to be doing the pump. Remember, the heart is just a pump. So number one, this is not the way your heart looks. Your heart looks more like this, though this is actually a very beautiful heart. This is a really healthy heart. What do you need to know about the heart? In general, you know it's a pump. It is a muscle that is pumping. What kind of muscle is the heart? It's cardiac muscle. And the cool thing about cardiac muscle, unlike skeletal muscle, remember we said that the skeletal muscle must have the nervous system to generate nerve or action potentials for muscle contraction. No, that is not needed in cardiac muscle. It can produce its own nerve and action potentials. There's specialized cells in the heart that will produce these nerve action potentials. So you'll learn about those in physio. But that's one thing that's cool about cardiac muscle tissue. And what else do you need to know? Well, it starts beating from before you're born till you die. It never takes a break. It never rests. If it did even take a small little break, you would die. It's a pretty small little pump. It only weighs about 8 to 12 ounces, less than a pound, and it's the size of about a clenched fist. Every time the heart beats in one contraction, it's going to pump 70 cc's. Cc's is the same thing as mils, so it's going to pump 70 mils of blood per one heartbeat, one contraction. And I want to show you this. Now you may want to write this down. Cardiac output. What is cardiac output? Cardiac output is the amount of blood pumped by the heart in 1 minute. How much blood is the heart able to pump in 1 minute? Well, cardiac output is equal to the stroke volume. That's how many cc's the heart pumps in one contraction. We already said that was 70 cc's times the heart rate per minute. What is the heart rate? And we're talking about, on average, we're talking about the heart rate at rest. So if you're just sitting there and you take your pulse and you check your heart rate for a minute, that's going to be your heart rate. So let's plug in some numbers. So this cardiac output is 70 cc's per one heartbeat times your heart rate, 70 heartbeats per minute, and this is on average at rest. So you do the math, cross out those heartbeats, and you get 70 times 70 is 4,900 cc's per minute. That is your cardiac output. So your cardiac output in 1 minute, on average, at rest, is 4,900 cc's. That is how much your blood, your heart is pumping in 1 minute. So let's go back to this. So that cardiac output is about 5 liters. Remember, 5,000 mLs is 5 liters. So why did I go through all that? Well, on average, the total blood volume in an adult is 5 liters. So 5 liters and your heart cardiac output is 5 liters per minute, your heart is pumping your total blood volume in 1 minute. That is way cool. So this little guy in 1 minute is able to pump your total blood volume. That is awesome. That is just awesome. So the heart, it's a double pump. We've got the right side of the heart and the left side of the heart, and they are basically mirror images of each other. They have the same basic construction. They are separated by a septum, and whatever the right heart is doing, the left heart is doing. If the right heart is contracting, the left heart is contracting. If the right heart is relaxed, the left heart is relaxed. The job of the right heart is to receive all your deoxygenated blood, the used up blood from your body. It's going to receive it, and the right heart is going to pump it out to your lungs. Now, in the lungs, you're going to get rid of that CO2, and you're going to get O2, and you're going to bring that oxygenated blood, the O2-rich blood, back to the left heart. So the left heart's function is to receive the oxygenated blood that just came from the lungs, and it's going to pump it out to your body so you can give oxygen to your entire body. So, I put down the venous return is 5 liters per minute. We said every minute your entire blood volume is going to be recirculated. So the blood coming into the right heart is 5 liters per minute. The blood coming out of your left heart is 5 liters per minute. Here's that cardiac output is heart rate times stroke volume. So on average, what's coming out is 5 liters. What's going in is 5 liters. These numbers must match. If you have heart failure somewhere in your heart, you're going to have a mismatch of numbers, and that is going to give you problems. And we'll talk about that later. But just remember, whatever goes in the right heart must come out of the left heart. This is a simplistic diagram of the heart, but it will help you see what's going on within the inner workings of the heart. We have these two structures called the superior vena cava and the inferior vena cava. Now, these are veins. These are the largest veins in your body. The definition of a vein is it takes blood to the heart. So the superior vena cava is taking blood to the right side of the heart, specifically to the right atrium. It is bringing all the deoxygenated blood from all the tissue organs above the diaphragm. So everything above the diaphragm, your brain, your neck, heart, your head, neck, thoracic cavity, arms, everything that is above the diaphragm is being taken into the superior vena cava. Everything below the diaphragm, like all the abdominal organs, all the tissues below the diaphragm, abdominal organs, legs, all that used up blood is going to the right atrium from the inferior vena cava. Hopefully that made sense. So we're getting all the deoxygenated blood from your body dumped into the right atrium. From the right atrium, it's going to go through a valve. This is the this is the tricuspid valve. Tricuspid valve. The tricuspid valve is one of our AV valves, atrioventricular valves. Tricuspid is the AV valve on the right side. Atrioventricular is the valve separating the atrium from the ventricle. We have one on the right side and we have one on the left side. They have different names, but they are both AV valves. So the blood comes into the right atrium, it goes through the tricuspid valve, it goes into the right ventricle. Now the right ventricle is going to pump the blood out through this valve called the pulmonary valve. Pulmonary valve. When you hear the word pulmonary, that is referring to the lungs. So the pulmonary valve is going to open up. It's going to push that blood from the right ventricle into this big structure called the pulmonary trunk. And it's going to pump the blood through the left pulmonary artery, and this is the right pulmonary artery. What's the definition of artery? Arteries take blood away from the heart. This is taking blood away from the right ventricle. This is the left pulmonary artery. It's taking it to the left lung. The right pulmonary artery is taking it to the right lung. How do you know this is the left pulmonary artery? Because this is the left side of the heart. Always look at your superior and inferior vena cava. When you see the superior and inferior vena cava, that is always going to be the right side of the heart. So we take blood away from the right ventricle, we take it to the left and right lungs, where it's going to get rid of the CO2 and pick up O2. And then we're going to bring blood back to the heart, to the left side of the heart, through these structures called pulmonary veins. Now, what's the definition of a vein? It's taking blood towards the heart. In this case, it's taking it towards the left side of the heart. So this is the left atrium. So the left and right pulmonary veins are taking blood to the left side of the heart. So what you need to understand, we're calling these pulmonary arteries. A lot of people think, oh, arteries always have oxygenated blood. Always remember the definition of an artery. It's taking blood away from the heart. So this pulmonary artery, it's deoxygenated blood. This pulmonary vein, it's a vein, but it's oxygenated. So keep that in mind. But this is carrying blood towards the left heart from the lungs, and this is oxygenated blood. If you have problems with understanding that, ask me. So we get our oxygenated blood going to our left side of the heart from our left and right pulmonary veins. From there, that oxygenated blood is going to go through this AV valve on the left side called the mitral valve. It's going to go through the mitral valve, go into the left ventricle, and from the left ventricle, it's going to be pumped out through this aortic valve, this is telling you I am going to the aorta. Now, the aorta is our largest artery. It is huge. So the aorta is an artery. It's taking blood away from the left side of the heart, and it's going to take blood to the entire body. Got that? So, how do you remember these valves? We got the two AV valves, and then we have the pulmonary and aortic valves. These are our semilunar valves. How do we remember which ones are on the right and which ones are the left? So start from the right side of the heart. You're going to go through the tricuspid valve, and then you're going to go through the pulmonary valve. Then on the left side of the heart, you're going to go through the mitral valve and the aortic valve. So blood flows through the valves from right to left. Remember this little phrase, toilet paper, my blank SS. You can kind of, well, this is going to be an A because that's for aortic valve. Tricuspid valve, pulmonary valve, mitral valve, aortic valve. Toilet paper, my blank SS. So that's just kind of a brief run through of how the blood is flowing through the heart. Now, why do we even have valves? Why do we have all these valves what are they doing? Valves are directing the flow of blood through the heart, and it's going to flow in a one-way direction. We want to make sure the blood is flowing in the proper direction. We don't want any backflow of blood. So we've already talked about the two kind of AV valves, the mitral and tricuspid. Tricuspid on the right, mitral on the left. Sometimes you will hear the mitral valve called the bicuspid valve because it has two cusps. But clinically, no cardiologist is ever going to call it the bicuspid valve. It will always be called the mitral valve. So learn it as the mitral valve. And you have the two semilunar valves, pulmonary valve on the right and the aortic valve on the left. So far, so good? I hope so. Now there's something called the cardiac cycle. Now the cardiac cycle is the events that occur in the heart during one heart contraction, one heartbeat. Now here's an EKG. This is an electrical tracing of the heart because this is all electricity that's triggering the heart to contract. So we're measuring the electricity. These guys here, you don't need to know what this is called. This is QRS. This is just showing you, this is the ventricles. When the ventricles contract, those are the big chambers in the heart. When they contract, there's a lot of electricity generated. So we are seeing 1, 2, 3, 4, 5, 6, 7, 8. We're seeing 8 heart contractions in this EKG strip. And you'll learn about this in physio. So what happens in one heartbeat? Well, the cardiac cycle has two phases. Diastole, that's when the heart ventricles are relaxed and the heart is filling up with blood. And systole, this is when the ventricles are contracting and they're pumping the blood out into their respective arteries, either the pulmonary arteries or the aorta. So let's look at what's going on in diastole when the ventricles are relaxed. So when ventricles are relaxed, the blood is flowing in from their respective veins. So veins are taking blood to the heart. Here we have the superior an inferior vena cava, taking its blood into the right atrium. And then you can kind of see here's the left pulmonary veins taking blood into the left atrium. And this is showing you the right pulmonary veins. You can kind of see little holes there where they're taking their blood into the left atrium. So far, so good. We're getting blood delivered to the heart. These AV valves on both sides are opened so that blood is flowing freely into those ventricles. So far, so good. Ventricles are relaxed. The blood is freely flowing in from the right atrium. It's flowing into the right ventricle. From the left atrium, it's flowing into the left ventricle. AV valves are open. Those semilunar valves are closed. Now, in systole, the ventricles contract. So the ventricles are contracting. The right ventricle contracts. Left ventricle contracts. Those AV valves are slammed shut by the force of the contraction and the blood pushing on those AV valves. And the force of that blood and the contraction of the ventricles is opening up those semilunar valves. So in systole, the AV valves are shut closed. The semilunar valves pushed open. Got it? Now we have heart sounds. You've all heard that lub-dub, lub-dub, lub-dub. What is making those heart sounds? So when the AV valves are closing during contraction of the ventricles, remember the AV valves close during systole when the ventricles contract. That closing of those AV valves when they are shutting closed, that is the lub sound. Now the dub sound is made when diastole starts and the semilunar valves are going to be closing. I know this makes no sense. I'll show you something that will hopefully make sense. But basically, lub sound is the closing of the AV valves as the ventricles contract during systole. The dub sound is the closing of the semilunar valves during the start of diastole. So what does it sound like? Lub-dub, 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 lub-dub. Lub-dub, lub-dub. Can you hear that? Lub-dub, 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 lub-dub. So here is what is going on. So here's diastole, ventricles relaxed. Look at those. Look at the AV valves. So this is lub, dub, lub, dub. So during diastole, AV valves are open. During systole, AV valves close and semilunar valves open. And during diastole, the semilunar valves are closed. So this is systole, diastole, systole. Okay, there's how it goes. It's a little bit faster. That's normal how it goes. Just wanted to show you a little bit faster. Lub dub, 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 lub dub. Back to slow. Here's diastole, systole, diastole, contraction, systole, diastole, relaxation, systole, contraction, relaxation, diastole, contraction, systole, relaxation, contraction, relaxation, contraction, lub, dub, lub, dub. Hopefully that you can see that. It's pretty simple once you figure it out. Always remember, if the AV valves are open, the AV valves, when they're open, it's during diastole, and during diastole, those semilunar valves are closed. During systole, the AV valves are what? During systole, during systole, the AV valves are closed, the ventricles are contracting, and the semilunar valves are open. So in systole, the blood is being pumped out of the ventricles and to the arteries. Pulmonary artery or the aorta. I think that hopefully that explains it. The other thing that we are going to be looking at is there's going to be little tendons. They're going to look like little, they call them cord tendons, and they are going to be holding down these AV valves during systole, because during systole there is a lot of pressure pushed on these AV valves, and these little cords that we're going to see hanging off of these AV valves, they're holding down the AV valves so they don't flip backwards, evert, which is like going backwards and letting the blood flow into the right atrium or the left atrium. So I'll show you those in a little bit, but just imagine the force of the ventricle as it's contracting and pushing on those AV valves. It pushes on those AV valves, makes them shut, but there's so much force, we don't want those valves to flip backwards. And that force is pushing those semilunar valves open. Hopefully that makes sense. So now that you know what normal heart sounds are, you know the lub-dub, the first heart sound, the lub is the closing of what valves? The AV valves. The second heart sound, the dub, is the closing of the semilunar valves. So when you say you have a heart murmur, you are hearing something that sounds, you're hearing the blood flowing through the heart, and you should not be able to hear the blood flowing through the heart. All you should be hearing is the closing of those valves. Lub-dub, lub-dub. That's all you should be hearing. So if you hear something, you hear a murmur, it means there's something wrong with a valve. So depending on which valve is causing the problem, it may sound a little bit different. Now, one of the most common murmurs is a mitral valve murmur. Now, mitral valves are remember, the mitral valve is on the left side of the heart. And this is under a lot of pressure. We will look in a little bit, the left ventricle, the muscle, the wall of this left ventricle is much thicker than the right ventricle. This is a pump. This is a muscle. The left ventricle has to pump blood where? Out through the aorta, and the aorta is taking it through the entire body. So when you feel a pulse, you can feel your pulse in your neck, in your arm, in your lower legs. You are feeling the force of that left ventricle. That is a huge amount of force. So you can imagine the force that's being pushed against that mitral valve. So what happens with some valves, if they're damaged, this mitral valve is going to start leaking. You can have actual black backflow into the atrium. So instead of all the blood leaving the left ventricle and going into the aorta, some of that blood is going through that mitral valve and into the atrium, and you're going to hear the swishing sound of it. So I'm going to play you mitral regurgitation. So regurgitation, it's just the blood is regurgitating back into the left atrium, and you can hear it. So let's see what it sounds like.
Mitral regurgitation. The characteristic auscultatory finding of mitral regurgitation is a holosystolic murmur of constant intensity, which is heard best at the cardiac apex. This murmur is high-pitched and blowing in character. Listen to a patient with mitral regurgitation. I will start with 3 normal beats and then add the murmur.
Lub, dub, lub. Holosystolic. He said the murmur was holosystolic. It's throughout systole. That swishing sound.
The intensity of the mitral regurgitation.
So that swishing sound was the blood regurgitating back through the mitral valve into the left atrium. Now, I don't expect you to know that that was mitral regurgitation. All I want you to know is that I know what a normal heart sound sounds like. That lub-dub is easy to hear. So when you hear a murmur, what are you going to say? You're going to go, I hear a murmur. That means something's wrong with a valve. You don't have to know, at least in my class, you don't have to know what valve it is. You just have to know there's something wrong with a valve. Got it? Oops. I think I've got another slide here. Yeah. So I wanted to show you, this is the last slide here. This is a better diagram that shows you the inside of a heart. Here again is your superior vena cava, and here is your inferior vena cava. Remember, these are the largest veins in your body. Veins bring blood back to the heart. So superior, inferior vena cava bringing blood back to the right atrium. Here is the AV valve. What valve is this? It's on the right side of the heart. It is the tricuspid valve. Here is the right ventricle. Here is, what valve is this? It's a semilunar valve. It is the pulmonary valve. Here's the pulmonary trunk. Here is the left pulmonary artery. Artery takes blood away from the heart. Here is the right pulmonary artery. And where are they taking the blood to? They're taking the blood to the lungs. Remember, this is all oxygenated blood on the right side. So they're going to go to the lungs, and it's going to bring blood back to the left side of the heart through the pulmonary veins. Veins take blood back to the heart. So these are the left pulmonary veins. This is the right pulmonary veins, taking blood back to the left atrium. What valve is this? This is the mitral valve. You can kind of see right here, here's the left ventricle, and this is going to be the aortic valve, the semilunar valve on the left side of the heart. So I wanted you to look at these valves. Notice the AV valves have these tendon-like structures. They call them chordae tendineae. You must know what chordae tendineae do. Chordae tendineae, these little cords, are attached to muscles. See these muscles here that look like little nipples? Remember we said if anything it has the word papillary. Papillary means little nipple. So here are our little nipple muscles. They look like little nipples. These are papillary muscles. These chordae tendineae are attached to the papillary muscles. Here's the valve up here. Here's the valve up here, and here's the chordae tendineae. So what happens when the ventricles contract? What's that called when ventricles contract? That is systole. So during systole, when the ventricles contract, these papillary muscles, their muscles, they are contracting too. They are pulling down those chordae tendineae to keep those AV valves from flipping back up. So hopefully that will make more sense. You need to know what they are doing. These semilunar valves, they look like they call them semilunar because they kind of look like little moons, half moons there. What happens with once the ventricles relax, there's going to be a little bit of backflow from this pulmonary trunk. So the little bit of blood that's left here is going to trickle back down, fill up these little cups, these semilunar cups with blood, and it's going to close those semilunar valves. Hopefully you can kind of figure this out. You'll look in your textbooks too, so you can see what is going on with the blood flow through the heart in this cardiac cycle. The other things I wanted to have you see was the layers of the heart. The epicardium. Epi means on top of. It's a thin layer. Actually, it's one layer thick, and we'll talk about that in a little bit too. Then you've got the myo. Myo means what? Muscle. The myocardium is the muscle layer. That is the biggest layer. This is the myocardium on the left side. Look how thick it is compared to the myocardium on the right side. So thin. Why is it thicker on the left side? Why is it so thick on this left ventricle? Where is the left ventricle pumping blood to? To your entire body. It's got to generate a huge amount of force. Where is the right ventricle pumping blood to? Next door to the lungs. They're right next door. They don't have to pump as hard. And here is your interventricular septum, the septum that is interventricular, in between the ventricles. So I hope that gets you just started with what the functions of the heart are and the general outlay of what's going on. If you have any questions, ask me. Read through your lecture notes on the heart and follow along with this video too if you need to. But hopefully it makes sense. And I think that's it for this one, and I will have at least one, if not two other heart videos. That's it for now. Bye.